So welcome. We are a smaller group today, but we are excited to have y'all who are joining. We're going to give it another couple of moments before we get started. And just to orient you, you are in Civic Health 101. And we have the team here, and we're going to get started in a couple of moments. Feel free to text your buddies to come in and join if you have any who might be interested in the topic. And we'll get started soon. All right, we'll give it a couple more moments. Okay. So for the sake of time, we will go ahead and get started and have others join us as they can. I'm going to put my slides in slideshow view. Okay, so welcome everyone. Thank you so much for being here. We are Civic Health Alliance, and we are really excited to be presenting this workshop to you, talking about civic engagement. This is a workshop that we hold every quarter, give or take, and we hold in different iterations as well. We have a big team on that I will introduce in a moment. But what is Civic Health Alliance? So Civic Health Alliance is a nonpartisan group, and it's really a coalition of individuals who have come together to think about how we can improve civic engagement within healthcare settings and for populations that may have higher health burdens that need to be addressed. So this whole idea is to start to use civic engagement as an additional tool in our healthcare resourcing and toolkit. So one of the things that we've gotten to do at Civic Health Alliance, in addition to having these trainings and really being able to share a little bit more about the trainings that we do, is we have a pretty big team that does lots of different things. I'm going to quickly introduce them so that you have a sense of who to reach out to. The first person I'm going to introduce is Russia. Chavis Cardenas, who is our former lead of partnerships, who will be co-presenting this workshop with me today. Russia's role has been transitioned over to Ms. Jessica Dennehy, who will be our new partnerships lead. So if you're joining and you're interested in learning more about what Civic Health Alliance does, Jessica D is going to be the person who will follow up with you and make sure that we get you connected in. What connected in means is you get added to the newsletter, we reach out when there's events, we co-host events with you, and really just kind of integrate you into the civic health community. I want to also introduce you to Jessica G, who is the person that basically helps us run all operations and does a lot of work around communications. And so we like to spotlight and highlight different stories of individuals engaged within civic health work and healthcare spaces. And Jessica is the person that really finds, writes, and kind of sources those stories. And then next, I'm going to introduce you to Julia Kuzer, who I'm going to put the slide back up. But Julia is a med student, and so she's literally on rotations as we're speaking. She's going to be leading our social media and communications work. And she has just joined the team to start this work. I'm sorry, I'm realizing that I need to share this screen with you again. And she came to us as part of our student ambassador program. So the student ambassador program, can you see my slide where it says, what is Civic Health Alliance?
Yes.
Yes, great. The Student Ambassador Program is one of the features of Civic Health Alliance we wanted to share with you today. And we want to share it by having one of our student ambassadors, Maisa, share a little bit about her experience. The reason why we're doing this is because we talk a lot about what it looks like to show up within healthcare spaces and do this work. And we do it for those who are attendings, those who are staff members, those who are patients, and those who are trainees in our system. So Maisa has been a student ambassador and wanted to share a little bit about her experience to give you all an idea of what it looks like to do this work on the ground. And our offer is to say, if you know of other trainees who may be interested in getting engaged, we'd love for you to send them our way. So I'm going to go ahead and turn it over to Maisa just for a minute or two of her experience. You can get a sense of the richness of the program.
Hi, everyone. Can you hear me?
Yes.
All right, perfect. Thank you guys for having me. Essentially, I joined as the ambassador here, and I'm really excited about the program. A few things that I've been working on since I am local to the Queens area in New York is engaging with hospitals, specifically at New York Presbyterian Hospital. I have a few friends who work there, one of which my best friend is actually one of the nurses in the stroke unit, and I find that helping, she's been able to help on the ground, essentially disseminate material and speak to her colleagues and advocate for health equity. And I feel like in her role in assisting this program, she's been able to essentially speak to patients who may otherwise not be so keen on voting or not necessarily understand their rights in regards to voting. So kind of starting at the ground up. In high school, I worked at, or we volunteered at Queens Hospital, so I do have some connections there and some connections at Elmhurst Hospital. So I do hope to at least engage in the local hospitals in my area and soon branch out. And include healthcare workers, whether it be nurses or staff, whoever may be willing to assist in the program. I think it helps in terms of health equity when people see a variety of people in the healthcare system advocate for them and reiterate the importance of how eliminating barriers would be important in mitigating any healthcare issues they may come across. So that's what I'm hoping to do. And if you guys have any other ideas and would like to throw it my way, feel free to do so. Thank you.
Thank you so much, Maisa. And thank you for kind of just taking it and making it as organic as you have. You've really set the example of Civic Health Alliance's work is work that you customize and you design. So we're here today, we're gathered here today. We're here today because many of you have said, well, civic engagement in healthcare sounds interesting and sounds like something that I'd want to do. I'm not totally sure what that means, and I don't know what it looks like to do it. And so what Russia and I are going to take you through, and let me just fix the spotlight. What Russia and I are going to take you through is a really practical approach to doing this work within your various healthcare spaces. Let's give the slides a moment to load. So I'm going to give it a start, and then due to a family health issue, I'm actually going to be stepping away a little bit earlier. I'm going to have Russia and the rest of the team take you through the rest of this program. So I want us to kind of think through what we'll be getting with the time together. So we're going to talk about civic engagement, why it's important, and then I want to make the case for civic engagement and civic health. What does that mean? Why do we talk about it? And I think what's really exciting is to start to talk about how you can do this work at the individual level and then eventually at the systems level. The most important thing that we want to encourage here is to really get your questions, share experiences with you, and to create a sense of like, we have learned this together and you are trained and you can kind of move forward. In fact, when you're done, we're going to send you a little training certificate that you have civic health training because we think it's that important and that kind of hands-on. Please feel free to use the chat. Feel free to come off mute and just say something and I'll hear you and I'll stop and I'm happy to answer questions, as is Russia, and we'll have time at the end for discussion. So before we kind of get started, what I want to do is I want you to consider, as though we were doing a Zoom poll, but I know we're all tired of Zoom polls, so I'm just going to have you consider in your head, as a healthcare professional, someone in the healthcare setting, what makes it hard for you to do the work of bringing civic engagement into healthcare settings? So what is it that makes this work hard? Is it time? Is it that it seems too political? Is it that you lack knowledge about it? Is it your own lack of comfort? And I just want you to kind of locate which of these, and it can be more than one, which of these is really the thing that's kind of the barrier. And I want us to be honest about how we can serve you to help to overcome and address that barrier. I also want you to be listening. For example, if you said that it might be too political, I want you to be particularly listening for the reasons that we're going to include in this training as to why that's not actually the case. And then there's a question of kind of your preparedness. So do you feel, so just kind of, in your own head, consider, do you feel prepared to bring civic engagement into healthcare spaces that you're in, whether it's an institution or your medical school? And so is it, yes, I definitely feel prepared. I feel ready. I'm good to go. Yes, somewhat, I could use a little bit more, or neutral, or no. And again, want you to kind of consider this as you're listening, because I want you to be really primed and prepped to be able to kind of take in different parts of this. The reason why we are invested in this work, and Civic Health Alliance was started in actually 2020. And it was started in part because we, as 4 clinicians that started it, noticed a lot of questions from our patients around, can I vote with this pandemic happening? And then as time went on, we noticed that our colleagues were facing growing burnout from the administrative burden of healthcare, but also from the impact of the COVID-19 pandemic, and saying, my patients that have COVID, I can treat their COVID, but then they still go back to their overcrowded housing, or, to the circumstances that really have made them sicker, right? How do I address those social determinants of health factors? So we believe that civic engagement is one way to be able to help to address that, and specifically to address the social and political determinants that so impact the way that we all kind of experience health and healthcare. And so there's an engagement model that we use, which is we're thinking about this work not just for these, big name presidential elections, but year round. And the way that we're really thinking about this is, how do we foster relationships with organizations or with individuals within the healthcare space to move this forward? And one example that we'll talk about is the Civic Health Compact, which is a way that we have shared for health institutions to kind of understand how they can do this work. But the engagement model is to say, individuals, organizations, if you're invested, let's do this civic health work together. So if you're sitting here wearing your hat as an individual, fantastic. If you're joining and you're wearing your hat for an organization, you're going to hear us talk about the kind of organizational approach as well. Our kind of theory of change in our offering is that we share insights and we share resources. So we share the reasoning why this work is important, and we provide you tools and resources. And the graphic you're seeing to your left are all of the tools and resources that you can just go on our website. And I think Jessica G has shared it already, but if not, you'll see it again. Go on our website, go to the resources tab, and you can download and customize all of these resources, signature edits, posters that have key information like the legal guide, which I'll share with you, slides, just basically anything that you might need to get yourself to flyers with QR codes. Anything you might need is here. And this is why Jessica D is so important, because if you want to customize this stuff and really get it, to have the logo of your institution, for instance, let us know and we'll be able to get all of that to you. But as we're starting in on thinking about, okay, so we engage all year, we engage with individuals and we engage with organizations, and we engage by offering you the materials to make it easy, there's this question that comes up of like, so why are we talking about civic health and healthcare? Like, how does this all come together? Many of us know the 5 areas that we talk about when we talk about social drivers of health. We know that these 5 areas are the non-biomedical factors that impact population's health and ultimately individuals' health. But many of us don't really think about how communities can gain power and actually build more cohesion to be able to address these factors through civic engagement. And so when we talk about civic health, it's a combination of civic engagement with population health. And we really think about the impact that it has on physical and mental health, and the importance that it has for kind of offering inputs into things like social welfare policies that really provide safety for all of us. So I've been using the term civic engagement, and I want to define it for you. Civic engagement covers all the ways that individuals and collectives of individuals or organizations participate in their communities and public life in service of addressing issues of public concern or improving community conditions. So a civic engagement project is not, I need better, headphones, so I'm going to go ahead and call my local elected official to get me better headphones, right? That's not an example of a civic engagement kind of project. But if you say, I notice that the sidewalks in this particular neighborhood where we have folks that use wheelchairs, the sidewalks are broken, and we're going to combine and sign letters to ask our elected officials to get the Department of Transportation to fix these sidewalks. That's a great example of civic engagement.
Hey, yo, Facebook Live, what up?
Oh boy, let's see. My apologies, I just heard something. Let's just make sure that folks are muted. And just give me one moment,
At this
y'all.
whack ass funeral.
I'm just gonna remove a couple of folks because I'm not sure of who is joining. And so I'm just gonna take a moment and just let some folks in and take some folks out. But I apologize for the pause. We do get some engagement whenever we talk about civic engagement. We get a little bit of folks wanting to sabotage, which is unfortunate. And my hope is that that's not going to happen today. So is everyone okay? Let me come off screen, make sure everyone's good. Okay. Okay, and I'm just going to hold on some of these. I'm going to hold on some of these additional folks that are trying to come in. I'm having a feeling that the bot farm has found us and is sending their peoples. So this isn't my first rodeo. I was once doing a conversation about climate justice, and we got bombed by a really insane group of people who just like played porn the whole time, and it was traumatizing. And so I say that because I'm about to keep all of us safe and keep the bots out. I'm ready. Okay. Continuing on. So when we talk about civic engagement, and I just gave you the example of what it is, it's a continuum. It's everything from showing up and voting to being an elected official, and everything all the way in between. It's letter writing, it's meeting with your elected officials, it's inviting your elected officials to come in. It's all of these things that we do to really make sure, again, that we're protecting the health and well-being of our communities. And so there's a proactiveness to it, and then there's kind of a passivity to it, if you will, like just showing up and voting, but all of it is an example of civic engagement. And so the kind of types that I think people tend to see and kind of tend to wonder, like, okay, so what should I consider? Some of these different types belong in certain places, and some of them don't belong necessarily in places like in the healthcare space. And I say that as someone who is not trying to be restrictive, but just wants to acknowledge the level of comfort folks have. So for example, get out the vote activities are absolutely recommended for within healthcare spaces. Organizing about particular issues may not be, given the healthcare, depending on the healthcare policies, or excuse me, the HR policies of your health institution. But we offer here the different types of civic engagement because we want you to be aware of the kind of wide range that it can take, and that all of it is considered, okay? So what about the health impacts of being civically engaged? I want to note this because I think for those of us who are in healthcare, this is very comforting to hear. Major impacts on mental health and impacts on some of the social determinants that we see. People who have in one study that looked at over 200,000 individuals, those who self-reported better health outcomes as they got older were also more likely to be those who voted. It's correlation, but it seems like these activities do have some kind of health impact for individuals. And digging down into some of these studies, these are really around the mental health space. And so the kind of things that we've seen at this point is that, and I'm going to summarize these because we go into detail with them in some of our trainings, but essentially civic engagement has been associated with decreased depression and anxiety over time. So longitudinal studies that have looked at youth or young adults over 15 to 20-year span in various countries have found that this has an impact. And so what do we see in kind of in our realm, kind of in the negative, right? We see the opposite. And I think about this a lot. I see patients in New York, in the Midtown area, but I trained in Manhattan, excuse me. Sorry, I don't know why my screen just went off. Can everyone see my screen still, or did it go off?
No, it went off.
Okay, give me 1 second. There's just an issue with me trying to avoid letting some folks in. That's kicked us off. So let me just make sure that I can share my slides. And so I see patients in Manhattan, but I've trained in the Bronx. And one of the things that I found that was so interesting, or that I find that's so interesting, that I look at whenever we get the kind of post-election results, is the voting rates. I live in Brooklyn, trained in Manhattan, trained in the Bronx, work in Manhattan. Is to look at the voting patterns for these areas. And it isn't super surprising that in some of the areas that are considered some of the poorest congressional districts in the country, with some of the highest SDOH burden, also have really disparate voting kind of turnout. And so if you look at Manhattan for the 2020 election, you can see that the kind of, and this is for the primary and the general, but just looking at the general election, over 65% are able to get to the polls. In Brooklyn, that's down to 59%. In the Bronx, that's 56%. And Aliyah Bhatia of VoteER will talk about why this is important, because literally resources will be allocated to areas where there's a higher voting population. They will say these individuals are individuals that, you know, seem to be more likely to engage. And so we're going to allocate more resources to them. And so it's something that, you know, is it that because people are disenfranchised and have lost the right to vote because they've been in the criminal justice system, et cetera, is that why we're seeing some of these, you know, SDOH factors, or is it the opposite way? Regardless, there's a correlate here that's really important for us to consider. And so when we talk about kind of the why, what civic engagement is, how civic health, how it impacts mental health and physical health, one of the reasons why we are particularly talking about this to this group is that there's ways in which within the healthcare setting, we can do the work of bringing this information to our healthcare colleagues. And it can happen in morning meetings, it can happen in lectures, et cetera, et cetera. The kind of the why that I've just stated out, the motivation that I've just kind of laid out for you is something that many people don't have because we didn't train in it, we didn't learn it, it wasn't something that we were super aware of. And yet it's important to start with that motivation because so much of the action that we then take comes from there. So we've talked about the why. Let's talk about actually doing the work and getting to a place of why this is important. In the Healthy People 2030 report that's come out, it's actually stated, and I'm going to start talking about voting, and then Russia will take you through some of the other ways of engagement. It stated that the importance of voting is so tremendous that it's one of the markers of a healthy population. Not only, as I've said, not only does voting, allow for certain policies to be passed or increase social services designations to that community, but it also sometimes can represent to elected officials the level of quote unquote importance and focus that communities should get. And as I just showed you in the previous slides, certain communities that have been historically disenfranchised, as we see they have less voter turnout, it continues to kind of replicate what's happened historically. So we think a lot about this, and we think a lot about this as part of our policy to health cascade. As a doctor, I see the impact of poor policy on my patients, physically on my patients. For example, someone comes in, God forbid, septic after a home abortion attempt. That is a result of policy that's come down by preventing institutions from providing reproductive health services that's then impacted patients. To go all the way back up to say, how do we impact those policy decisions? Voting is one of the first and easy steps to do that. We spend time here on the importance of voting because, again, there's a sense and a feeling of really being nervous, if you will, about how you engage and who you engage with and what you can do in this kind of space and in this world. And I would say voting is in some ways a low-hanging fruit of what can be done that can have an impact on this policy to health cascade. And so what is it? Let me just make sure. And so what does it look like to kind of take this on? One of the first things that I want you all to do is to consider, am I registered and do I have a voting plan? And then there's many other things that we're going to take you through that you can do as an individual, or even better, that you can do as an individual, or you can do as an institution to get individuals kind of ready to go. And so I'm going to just spend one moment on this slide here. One of the questions that I tend to get is a question around has this been done within health institutions where people have gone out and they've actually tried to get out the vote within health systems? And absolutely yes. A 2013 study by one of our co-founders did this work at an FQHC and found that of the 320 patients that they approached, they just talked to people in the waiting rooms. They were able to register 128 of them. So the healthcare space is one where people are kind of a captive audience. They're waiting for us for 30 minutes anyway, right? They trust us. And it's a place where we can really bring this information to them. And the getting out the vote kind of work is one of the first things that can be done that we think is incredibly important because of the reasons that I've outlined. So I'm going to turn it over to Russia, who's going to talk a little bit about some of the additional levers that really come into play.
Thank you, Stella. I'm going to get set up, y'all, and share my screen so I can navigate the slides. And if I can get a thumbs up if you guys can see that.
Yes, we can see.
Yes, awesome. Thank you. So I'm going to talk about the additional levers for civic engagement. Stella laid a really good foundation for voting as an entry point, but we know it doesn't end there. And so one of the resources that Civic Health Alliance leadership created to help folks in the healthcare industry participate in this work and to set up those voter registration booths was this FAQ. So what are the legal guidelines and the laws allowed to do? What can you do in a healthcare setting? And the reason leadership set this up was because they noticed that when they were asking their healthcare institution, I would like to set up a nonpartisan get out the vote registration campaign, there was pushback. And so they worked with an attorney, and they said, no, the IRS code allows all public healthcare institutions and private and nonprofit healthcare institutions to operate nonpartisan voter registration drives if they like it. And in fact, the law goes a little bit further. Under the National Voter Registration Act, if you're a federally qualified health center and you provide Medicaid or Medicare services or federal government services, you must provide voter registration services. And so sometimes that looks like the form that you'll get that you'll fill out on the long hard paper form that you would fill out. And you can kind of see those pickup and boxes in those centers. And so the law actually requires it that federally qualified health institutions have nonpartisan ways individuals can vote in their healthcare setting. And so when Stella was mentioning that there are resources that Civic Health Alliance puts together for folks to have in their back pocket, this is one of those resources. We have found that it's useful and it helps folks who are in the healthcare setting to rely on this when they're having those uncomfortable conversations with institution leadership that may get a little pushback and say, hey, I'm not really comfortable with this. What can we do? What does the law allow? Having some of this information in their back pocket to say, you know, this is what the IRS code law allows. This is what the National Voter Registration Act says. This is what it says about federally qualified health centers. It helps as a resource when you're having those internal conversations. So now I'm going to get into the legislative impact, and I'm going to kind of go into the different branches of government and the ways in which healthcare professionals and those involved in the healthcare industry can participate in civic engagement. And so when we think about the branches of government, what does the legislative branch do? They develop policy through bills, they develop resolutions, ordinances, and then another thing that they often do that we don't think about is they appropriate funds through budgets. So they hold the power of the purse. And then the follow-up question is, well, how can healthcare professionals influence legislative outcomes? And that is healthcare professionals can make phone calls and meet with legislators. They can participate in legislative hearings. They can submit letters and comments to legislators and committees on bills that are being considered or other policy matters that are before the legislature. And so we dove deeper into this last year and thinking about some specific best practices and ways that healthcare professionals can engage with legislators. And there was a research study that we found that was a specific analysis to discuss best practices specifically for health professionals to engage in the legislative setting. And so that information, that research said that 76% of the legislators that they studied, they desired local data and statistics. So information that you may have about a specific research study that you're working on, or a project that you're working on, or a specific population that you work with, that's the type of information that they would like to hear. They really do and sincerely appreciate proactive oral communication. So a phone call or an email, tours and presentations. I know that when they're not in session, so when they're not physically in their state capitol buildings or in their other city hall areas of a business, they really like to be in their community. And so when legislators are back home in their community, one quick thing that you could think about is offering them a site visit. Hey, come to our facility, come to our site so you can see the population that we're working with. And they love that stuff. They like to get hands-on. If you ask their staff and their chief of staff to come out for a tour, if there's something that you want to show with them or discuss with them, they'll likely come out. The other thing is if you're going to have any other sort of communication and working with legislators, they really like one-page succinct documents that are formatted in bullets, policy briefs, things, handouts, stuff that's quick and tangible because they have a lot of information coming to them. And I think I would say here is recognize that you are the health subject matter expert and that they're going to be relying on your expertise to inform the decisions that they're making. They know that they are not the Jack and Jill of all trades and that they're relying on others to inform the decisions and the votes that they take on the floor. And so we just try to have this resource. This worksheet and this sheet is available on the Civic Health Alliance website as well. Thinking about the executive branch. So what impact does the executive branch have in civic engagement and public policy making? So the executive branch is responsible for implementing the legislation that the legislative branch just passed. So if the legislature passed a bill on providing additional mental health resources for people who are unhoused, then the executive branch would be responsible for picking that up and then implementing that. And they also develop and propose budgets, and they develop administrative guidelines, regulations, and other policies. Oftentimes, those administrative guidelines and regulations and policies are directly related to the legislation that was just passed. So if you take back to that example of additional services provided for individuals who are unhoused, the executive branch would be responsible for setting that program up and making the guidelines and the rules and the policies for how it's administered. So if that's a population that you work with and it's a program that you're still engaged in, it's still incumbent upon healthcare professionals to reach out to the executive branch and say, okay, if you're going to set up this program, these are my recommendations. This is what we see or what we're seeing on the ground. This is what would be helpful. You want to provide guidance along the same way you would in any other setting to the executive branch. And how can you do this? Meet with their departmental staff as they're setting up programs. Then there's judicial impact. And a lot of us think like, how in the world do we have impact on a judicial decision? And you do. And so what does the judicial branch do? They develop opinions, decisions, legal rulings, and they set legal precedent. But how can health professionals influence judicial actions? One of those examples is amicus briefs. Amicus briefs, they aid and inform the court of relevant points of law of facts that pertain to the case that they're hearing. And they're a very, very effective and powerful policy tool to shape public policy through the courts. As an example, Civic Health Alliance helped participate in an amicus brief related to reproductive health. That's what's before a federal court. And in that federal court, they were asking questions about the use of mifepristone. And some of you probably know what that drug is. It helps with women and others who are and other persons who are having need reproductive health services and they need use of that drug. And so what our organization did was we participated with a coalition of other health and allied organizations to submit an amicus brief to the court to help inform, like, we're the subject matter experts, we're the health professionals here. This is what mifepristone is. This is how we use it. This is how it's done, to inform the court on what they're going to decide. Can we use mifepristone anymore or no? And so that is how you can use your expertise to inform information that's coming in and out of the judicial branch. So now we're going to apply this a little bit. And this is all made up examples because oftentimes sitting in my seat as the public policy professional, folks are like, where do I begin? I get calls like, I don't know how to start this. How do I start? Where do I go? Like, there just seems like a black box. And so we have a little sample of like, how do you orient yourself to your legislators? And once we're done, I believe the team is going to send out these, share the slides. And so you can click through the links here. And what we have here is samples of where you can find your state and local elected officials, and then an exercise that you can do at a later time. And it's like, just write down who are your state legislative elected officials. Write down who's in the upper house, write down who's in the lower house, just so you can start to familiarize yourself with who are these individuals and going through that practice to figure out, how do I find out these individuals if you don't already know. The next step you'd want to do is just review, just skim their websites and write down a few of the policy issues that they're addressing. You'll find that some members are all over the place. They may have something related to a farm bill, and then they may have something related to AI. You're like, well, how are they doing this? And so that kind of gives you a flavor of what the policies that they're interested in. So then we have another example that we walk through, and it's like a legislative and it's an issue-based walkthrough. And so in this world, when we're thinking of issue-based policies, it can either be candidate-based or issue-based. And so this is going to be a issue-based issue, and specifically related around elections. So some time ago, the team were thinking about, how would we consider where Mississippi is in terms of allowing and having a greater access to the ballot and to the vote. And I was doing some background research on how do we find out what the position is of the current Secretary of State. And in that conversation, we were asking ourselves, how do we share this information so someone else could do the work that you've just done? And so where I start is I'll go to the Secretary of State, the Mississippi Secretary of State's website, and I'll look at their press releases and their columns, like to say, what is this individual talking about? What are they saying that's important to them? What is on there? What are their policy priorities? I'll find one. I did, and it was House Bill 1310. And then after that, I'll go into their legislative information system. So each city, state, and local jurisdiction will have a type of legislative information system. This is the system that houses where they're passing all of their legislation, all of their bills, all their resolutions, all their ordinances, that you can find in a consumable way. After that, I can click in it and find the bill. And now it's very easily able to find House Bill 1310 that was going through the legislature at the time in Mississippi. That's how you do it. Do you have any questions? I have a moment to take a question on that. If anyone's like, how is that done? No? Okay. And so we'll keep going through. When you're in there, may see like bills that are assigned to committees. So if you see the computer that's on the image, you'll see, the Agricultural Appropriations Committee. These are all the different committees. So if you're looking for like a health bill, you would go into the health committee. You can find out who's the chair of that committee, and you can see any other health bills that they're passing in that committee and during this legislative cycle. And you can also look at archives of what they've done in the past. And so the committee is really just a group of members, of legislative members who are just assigned to that committee, so that they can address in a public place and in public hearings and forums on issues that come up before them. And so you can find those committee listings on any of those legislative information systems that I was talking about. And so we like to use this little section. You can do this silently in your head. Just identify one local or national policy issue that concerns you. You probably know what it is in your head. And then next, I want you to think about any potential solutions you have to that. And then can you think about, just brainstorm quietly to yourself, any potential evidence that you would have to support your solution? And if you don't have any evidence, where would you go to gather it? And then consider any other past successes or failures with the solutions. Have they been tried? Is it a pilot? Is it still in its infancy state? Or is this tried and true and we know it works? And then think about what groups that you would share this with. In what settings would you share this information? What other allies would you share this with? And then what other settings would you bring this idea to? Okay. Does anyone want to share out their issue and what they brainstormed and walked us through? No one bold enough. That's okay. That's okay. Here's a summary of the advocacy and engagement strategies that we've discussed, some of which, and then there's more, right? And so ways that you can engage and have sincere policy outcomes, voting, making phone calls, having meetings, testifying before the legislature, written public comment, writing op-eds, donating to campaigns, and they don't only have to be political campaigns, they can also be issue-based campaigns. So if it's a mifepristone issue-based campaign, for example, you can donate to that if there's someone taking that up. You can write a letter, and then you can ask your government or elected official to tour your facility or service area. And there's more. Like these are just some high-level samples of what you can do in your settings. So I want to talk about a lived experience about community engagement and civic engagement that I had a chance to participate in, just to kind of bring everything that Stella and I have shared home to make it tangible and tactile. So you'll see in this picture that you'll see a number of images where you see this cargo storage, and you'll see housing that's right by or near it. And so a few years ago now, vacant land that was in South LA was rapidly transformed into cargo storage, and inundated the community with these 18-wheeler vehicles, and they were stacked incredibly high, and they were an eyesore. They did reduce property values. They increased pollution from the diesel exhaust. There was noise. There was a lot of shaking, physical shaking of the homes and apartment buildings. People couldn't sleep. And then there was increased rodents. And on the transportation side, and there was traffic safety issues, it blocked the sight of drivers and pedestrians who were trying to engage oncoming traffic. And nearby was a local Catholic church and a local Catholic school where students had to walk just past this street to get to a church that would be behind this image over here. And it was very dangerous. And so at the time, the residents all were we were just having this conversation, like, what is this? Where did this come from? Why, where are these trucks coming from? They were not here before, and now they're here. And so we did a little digging and found that it came from an executive order that was issued by the governor in California. And the intention of that executive order was to ease freight congestion that was happening down at the port of Long Beach in LA, because to reduce the congestion that was having because of the impact of the changes in supply demand. So once we got hit with COVID, everyone's buying and purchasing patterns changed. And so the normal flow of freight that was coming into the state to be delivered throughout the nation was stuck at the port of Long Beach. And those ports couldn't just wait out in the water endlessly. And so they had to find a way to bring that freight on land to just sit for a few moments before it could make its way throughout the nation and go on its route. So in order to do that, the governor released an executive order and said, all state and private entities, I want you to try to find your private land, and I need you to lease it to the state, and we'll pay rent for your property, your vacant property, so we can house this stuff, so we can get it off the water. And so this is an example of a lease agreement that we got. So we submitted what is called a Public Records Act request. At the federal level, it's called a FOIA, or a Federal Records Act request. You can do them at a local level. All public documents are public, and they'll just redact it if it's private or personalized information, and you can figure out what's happening. And so the communities, we submitted a PRA, and we got a copy of a lease agreement to figure out what is this? Like, why here? Why now? And we were able to get a lot of information. We were able to find out who the owners of the property were, how much the lease was for. We were able to find a lot of stuff with a PRA. And we did some further study, and we learned that the increased presence of supply freight, it drove up diesel exhaust in the community, and it contributed to a number of various health problems. We learned that long-term exposure to diesel exhaust poses the highest cancer risk of any toxic air contaminant, and that 3 departments in California, so the California Department of Toxic Substance Control, the California Air Resources Board, and the California Office of Environmental Health Hazard Assessment, they all agreed and all had on either their website or other research that found that Diesel exhaust from trucks contributes to a range of health problems, including irritation of the eyes, throat, nose, heart disease, and lung cancer. So we had a health policy issue on our hands. We further uncovered that the land that they were using was polluted, and that the land that the trucks were on had groundwater contamination and soil contamination. So what did we do? And we activated. So the community met regularly and attended community meetings to understand the problem. We developed relationships with government officials who are responsible for implementing the executive order. So that would, at the time, that was the California Department of Transportation. We canvassed the neighborhood and walked door by door and made contact with nearly 200 residents to inform them about the issue and to understand how a cargo was affecting them. And I'll never forget, we went out one night, and there were two young gentlemen in that first picture I showed you. That was an apartment complex. They were sitting on the stoop of that apartment complex. They're about 18, 20-ish. They were young, they were Black. And we asked him, we started talking about the issue and passed out a flyer. And he looked at me and said, "We can do something about this?" And my heart dropped, because I think a part of him thought, I just have to deal with it and I just have to live with it. And after I pulled my heart back up to where it should have been, I said, yes, yes, we can do something about it. And if you want to know more, like, work with us. So we established relationship with local media. And then we created Facebook groups and online petitions. And then we arrested the attention of our elected officials through letters and phone calls. So what the community did, I think we came up with some snazzy name, and it's forgetting me now. It's I think we call, like, Talk to Them Tuesdays or something. I don't know. But every Tuesday, we would call our elected officials every Tuesday. And if you couldn't do it that Tuesday, you couldn't. But you telling 200 people to call on a Tuesday, that's enough. At least 50 people will call every single Tuesday about the same issue. And so we were able to arrest their attention. And then we were able to secure the focus of the Los Angeles County Community Prevention and Population Health Task Force. We found a local task force that the government was running and talked to them about the issue, and they were able to make it a priority on their agenda of something that they were going to address. So we started hitting the issue from as many angles as we possibly could. And then in that petition, we were able to acquire the attention of a national nonprofit civil rights advocacy organization, and they partnered with us, and they wanted to reach out and amplify our message. And so the Color of Change saw the work that we were doing and said, "Hey, we'll help you amplify." And that was a game changer right there, because they have a huge platform. And then this is like a sample communication of what we would ask individuals to do. And we'd say, "Hi, my name is Addie Garnett. I'm a teacher and I'm a mother, and I'm concerned about the environmental impacts of freight trucks and cargo storage on my family and community." That's it. And then when they call, like, "What do you want?" "We want your office to stop the trucks from driving down 120th Street, allocate state funds to decontaminate the sites, and then we want your support for local community control over the land so we can determine what we want to do with it once the land is remediated." And that's what a sample pitch we would put together, and folks would call in and say something like that or whatever they wanted on Talk to Them Tuesdays. So the outcome, we were able to get the Caltrans to publicly state that they would not renew the lease of the land. And so once the lease was expired, they weren't going to renew the lease. So we were able to agitate enough. And to date, at the time this presentation was created, one site had completely removed all of the freight. So all the freight had been moved off of one. But what was next? There was two sites that still had to have their freight removed. And so what the community needed to do next was get the state and other non-state owned sites to remove their cargo storage from out the region, because these three sites weren't the only sites. Like, it was peppered. There was a map throughout South Los Angeles of where these were. it was interesting because the cargo storages only showed up in areas that were 95% Black and brown, and they were not in city boundaries, but only in unincorporated areas of the county. And so it was really interesting of how these these things showed up. But I gave you those two statistics to show that it was probably the two populations that have the lowest civic engagement. So there was a correlation there. And so how can our experiences apply to you? The one thing that I kind of kicked myself in the leg for was we didn't engage our local health care providers at the time. And if I were to do it again, I would have said if there's a clinic around the area, to talk to them to see if there's any health issues that they were seeing. Like, are you seeing more? And I know they can't say this, but at a high level, aggregated information, if you're seeing higher instances of eye and throat irritation, there's this new cargo storage that's blowing, literally. One of those images, I didn't pause enough to show you, but they were backing up the cargo storage so much. There was an 18-year-old girl and she had a window, like there was just plumes of smoke just coming into her bedroom every night. She's an 18-year-old female. I don't know what that will have on her reproductive health. We don't know the long-term cancer effects. And so if we could do it all over again, I would have tried to canvass also the local clinics and health providers in the neighborhood to let them know this is happening, and then to see if they would work with us to lend their voice and their expertise to help advocate in front of the different entities that we advocated with. And also to let them know that you may be seeing increased instances and there could be a correlation of why. And so I like to bring this example in because there is a direct connection between a policy decision that was made and then something that you could see in your clinical settings and may not understand why. So a summary of our community engagement is civic engagement exercise. You can consider at the community level what's impacting your community. Like, what are you guys seeing in your settings that you're seeing repeatedly? Take a drive around. A lot of the time, sometimes they are like physical environmental things that are happening in the environment. Learning about the local issues, attending the community events and local meetings, because that's where we were, and lending your voice on issues when your community is facing them is of utmost importance. And I think it's also incumbent upon groups like ours or grassroots organizations to reach out to the healthcare professionals and say, can we partner? And knowing that there can be a true partnership there. And so I wanted to ask as we get closer to wrapping up, but before we ask this question, is there any comments, questions, just to pause on that, like case study that we walked through? Saying none, just wanted to pause. This is another one to yourself. Earlier, Stella asked, how prepared do you feel bringing civic engagement to your health institution or school or setting? And you had an answer. And now that we're towards the end of this training, do you feel the same or any different? And then we want to open it up for discussion and questions. Any questions, anything you guys want to discuss? Anything you want me to run back to? I'm not seeing any hands. As we get near the wrap up, we leave a feedback survey. We take these very seriously, and we tailor trainings and resources and other services that we can provide to you all. So please fill out the survey, give us feedback, let us know what you liked, what you didn't like, what you would like more of, and additional resources that could be helpful to you. And we can see what we can do to try to provide them. Any other questions? I just want to thank you all on behalf of Civic Health Alliance for being with us this evening. I know there's a lot of time and you're pulled in many different directions. So one, thank you for your commitment to the health of yourself and your community. And thank you for your commitment to expanding that into civic health. So it's a ride, but we're on it together. Jessica G, is there anything else we need to do before we wrap up?
No, I don't think so, unless anybody has any questions. I am just trying to figure out how to stop recording it. But here we go.
Awesome.
All right, thanks so
Thank
much.
you, everybody.
Thank you, everyone.
Have a good one.
Thank you. Have a good night.
Bye.